Welcome back. If you've experienced cloudy or blurry vision or you're having trouble seeing at night, you might not just need a new pair of glasses. Dr. Tim Walline, a surgeon from Sabates Eye Centers, is here to explain the causes and symptoms of cataracts. So first off, what are cataracts?
Cataract is simply the clouding of your natural lens within your eye. It's a common phenomenon that pretty much affects everyone eventually.
Okay, and how do we know if we have it? Are we going to notice like things in our life are becoming more difficult?
Yeah, typically you'll notice that things are blurred in general, and that typical tasks like driving, reading, seeing the guide on the television become more difficult.
Okay, so it might not just be, hey, I'm getting up there. It actually could be a cataract, something more serious that should be addressed. Now, who would be a good candidate for cataract surgery?
Basically, anyone who has generally healthy eyes and is experiencing the symptoms and having the lifestyle issues. Maybe they have a hard time at their work on a computer, or just recognizing people across the rooms is difficult because of the blurring. They've given up driving at night because of the glare that's a common side effect.
Okay, and then in your daily practice, are there different tests that you would give to somebody to see what the best option would be?
Yeah, first of all, we'll test everything from front to back of the eye to make sure everything's healthy, starting at the cornea at the very front, all the way back to the retina, make sure they don't have other eye conditions or diseases that would preclude them from having a good result from surgery. And then we'll do a whole series of specialized tests to determine what's the best option for that particular individual.
Okay, well, you seem like a really friendly guy, like you could walk in, get these tests done, and find out what's actually going on with your vision. And you were also telling me that if you do get surgery, there are different lens options.
Definitely. We're very fortunate nowadays to have great options. We also can use a laser to assist us to minimize the operating time inside the eye, and then the various lens options basically go from the single focus, which we can tailor to a person's needs, whether they want to see better far or close up. We have an astigmatism correcting lens implant for people that have significant degrees of that. And then we have multifocal lens options, which give people the full range of vision, which is an amazing option these days.
Okay, all those things sound good, right? Correcting your vision, that can be so life-changing. But what are some of the different options during surgery, and what actually happens?
Yeah, during the surgery, it's very relaxed, low-key. A patient's sedated, but they're still awake. They don't realize what's happening because their eyes fully anesthetized, and it's a brief procedure, and really they're in and out in a very short time period.
Short time period, wow.
Yeah, minutes, literally.
Oh my gosh, minutes?
Well, their whole visit might be a little longer because we have to get them ready and do some pre-op health assessment, but the procedure itself is about 10 minutes.
Okay, and then how long quickly before we actually see results?
Oftentimes you'll see results like the very next day.
Wow.
Especially in our younger patients that are healthier and maybe are getting their cataracts operated on earlier before they've matured to the point of being more difficult technically. And then pretty much back to your typical workday and lifestyle activities like driving within just a few days.
Wow.
Yeah.
Well, Dr. Walline, thank you so much for all of that need-to-know information. If you'd like more details on treating cataracts, call 913-261-2020 or toll-free 800-742-0020, or check it out online at sabateseye.com.